It's Wednesday, August 21st. I'm Adam Walsh, and this is The Signal. Today on the show, healthcare and the cost of transportation. What's the reality? What's working? What are the gaps? And how do we fix them? That's the conversation, so don't go anywhere. So the Signal team, and by that I mean associate producer Amanda Gear and myself, we were talking about healthcare and just how big this province is, right? Newfoundland and Labrador, there's a lot of land, not a whole lot of people, right, when you really look at just how big this place is. And Amanda, who grew up in Happy Valley Goose Bay, was mentioning the idea of doing a show on the cost of travel for health, right? Because it can really add up, obviously. It's a giant issue for a lot of people. And in the past few years, there have been some changes aimed at helping folks. So we've got a number of voices lined up, and I'll get to the folks now in a minute. We've got two people on the line. We've got some tape to play. We've got another call to make. I will say, as you're listening to this show, how has transportation for healthcare impacted you or someone you care about, right? Someone close to you, someone in your family. As you're listening to us, either text us with some of these details, 709-327-8206, or email us thesignal@cbc.ca. How has transportation for healthcare impacted you or someone you care about, right? We'd love to get some of those details. As we were putting this show together, we got in touch with the government, right? And but due to a scheduling conflict, Minister of Labrador Affairs Lisa Dempster couldn't make the live discussion for today's show, but we're in talks for a follow-up interview in the days or weeks to come. That being said, we were sent the following from her spokesperson, Alan Bach, and just for all of our awareness, right? So this is some of the recent spending that's been done by the government. So the budget for medical transportation assistance has increased by $1.7 million in the last 16 months. 1,145 in-province flight vouchers have been approved since this new program was launched last September. 78% of vouchers have been issued to Labrador West residents. 20% increase in claims processed in 2023 to 2024. 30% increase in patients assisted in 2023-2024, and 50% increase in staffing in the last 16 months. Streamlined application process by revamping claim forms, clarified and reducing supporting requirements, and added sample forms to the website. So all that to say, there's more money being spent according to the provincial government, and there's been an increase in what's being processed. And they're trying to streamline stuff to make it easier. So that's the point that we got from Minister Lisa Dempster's office, just to put that out there as we set the table for the discussion today. Now, on the line, we have Labrador West NDP MHA Jordan Brown and Torgat Mountains PC MHA Leela Evans. Hello to you both.
Hello. Thanks for having us, Adam.
Well, Jordan, let's start with you. And Leela, I'll go to you second. But Jordan, for yourself, Mr. Brown, what do you hear from folks in your district about the travel costs for healthcare?
Oh, and it's what I hear it very loudly is a lot of people are just not happy having to travel for things that would be routine, would be normal in other parts of this province. Just today, I've been dealing with the fact that we don't do EEGs in Labrador or West anymore because of staffing issues. And so people are being referred to Corner Brook and St. John's. But under MTAP, EEGs are considered routine testing. So we can't even get them covered under MTAP. So people are paying out of pocket to go get an EEG done.
Explain MTAP for folks who may not be familiar with it.
MTAP is the Medical Transportation Assistance Program. It's a program that people can get some reimbursement for going out of Labrador or out of your region, but for most times it's for people who have to leave Labrador to go and get things that are not available in Labrador done. Mostly it's to go see your cardiologist or your any specialty medicine that's mostly found in the health science center.
Now, I did list off more spending and some stats just off the top that was sent by the government. Has any of the change? Have you seen much difference with some of the changes since last year? Since these changes were announced?
Most of what we're seeing right now is a lot of people are finding it very paperwork heavy.
Okay.
They're finding it very cumbersome to try to get some of this money. They find a lot of difficulty in trying to get all these letters and documentation and things that MTAP is requesting in order to get the funding. You need two letters. You need a letter to say that you have an appointment, but you also need a letter saying that you went to your appointment. You have to get things signed off by your doctors, and sometimes people there might be a tiny mistake or there might be something, so a lot of people have to go back and try to call the Health Science Center and try to get more documentation. People are finding it very red tape heavy and are getting very frustrated and very upset with it.
What is unique about your district when it comes to health and trying to help folks out and the travel needs that are the reality for Labrador West?
For Labrador West, it's not that we're unique or different. It's just that the lack of infrastructures here, the lack of doctors, the lack of that kind of stuff. We have a brand new hospital. It's beautiful. I call it a race car without wheels. Beautiful building, nobody in it. There's stuff that used to be done here for years in the old Captain Jackman Hospital that are no longer available here in Lab West, and we see less specialists traveling up to do clinics. Before, the cardiologist used to come up, or the oncologist, or one of those specialists would come up and book a day off and meet their patients that are up here and then go again. Now we're asking, instead of one doctor flying up to see 30 patients, the healthcare system is asking 30 patients to fly to St. John's. So really, it's not that we're unique or different. It's just a lack of forethought and lack of planning on, this government and the previous government, because for at least the last 20 years, we just seen a degrade in service. We used to have great service here in Labrador West, and now we're down to bare bones.
Leela Evans, we'll go to yourself now. What's the reality for your district, for Torngat Mountains?
Well, like I've raised the issue many times in the House of Assembly, and I said, to the general population out there in the province that's listening today, and to the ministers and everybody who serves in the Confederation building, the MHAs, in Northern Labrador, our healthcare is in crisis. It's been in crisis before we even had the pandemic, and people in my district are dying of treatable diseases because they can't access the services they need. And so for me, I got to say, Adam, this is very important. This discussion that I was invited to, I was told that Lisa Dempster, the Minister of Labrador Affairs, was going to be present, and Jordan Brown as well. And for me, that not have her show up, because it's not like we had to travel in and participate in person. This is a call-in, and I don't even think we're live right now. And
no, we're live. We're live. This is live, so no swears.
Okay, no, it's good that we're live. But I mean, myself and Jordan, we would have rescheduled. We would have made sure that we would have made ourselves available when the minister was available, because in actual fact, her department, Labrador Affairs, has taken MTAP out from the Department of Health and Community Services and moved it under Labrador Affairs, which we kind of question because it seems like more of a political decision. But for me, the barriers is not just financial barriers. There's a huge cost to people in rural parts of Newfoundland and Labrador, especially Labrador, being able to access health care. Financial burdens is really impacting people's access. But in my district, there's another layer to it. And it's not like they don't know about it now, because it's all I've been talking about in the House of Assembly through question period and petitions. And in my district, it's about trying to get out for your appointment. And if you can't get on that plane, because we're not connected by roads. When the provincial government was building the Trans-Labrador Highway, they've never connected my district. Not a single community, not a dollar for pavement, not a dollar for infrastructure has gone to improving the transportation in my district. So for us, we got to get on that plane. And if you can't get on that plane, you can't access your appointment. You can't see a doctor, a It may be a specialist or maybe the doctor, because we don't have enough doctors coming into our communities. It may be for an MRI. It may be some sort of diagnostic appointment that will determine what kind of disease, what kind of illness you have that could impair your quality of life, or it may be even end your life. So for us, it's not just about the financial burden. It's about access. And in my district, patients are bumped off the flight. Often patients have to cancel their appointments that's out in St. John's or in Goose Bay because they can't get out to their appointment. And then if it's a specialist appointment or if it's a treatment, it could take 3 to 6 months, even longer, for you to get that appointment rebooked. So to me, and I gotta say, and I've said it before, in my district, people are actually losing their lives to cancer, to cardiac disease, to diabetes. People are losing their vision to glaucoma, heart disease, cancer. And I got to tell you, it's really, really concerning when cancer patients can't get out to their appointments for their chemo. And that's a reality, for me. So being able to get out, and I've been raising it so much. And I think a part of letting the rest of the people know in the province what the barriers are for my district is sort of forced the government to try and, I guess, reduce the embarrassment of what they're doing to us, that they did commit or promise to increase the number of patient flights and seats available for people to be able to travel out to their appointments. But in actual fact, Adam, when they rolled it out, we had less flights. We had less seats on the plane. And I was talking to one of the nurses in Napashish, and she said, well, Leila, I'll give you an example now. If we need 11 seats, 11 patients going out for medical appointments, we're only getting 2. And so there's no improvement. In actual fact, I think they said that just to kind of kind of appease me and kind of try to silence me. But in actual fact, I do have the commitment, so they're going to have to live up to it. They are going to have to live up to their commitment to us, not only to me, but to Nunatsiavut and the Innu Nation, who have their members in my district.
And I will say, just to circle back for a second, for Minister Lisa Dempster, in discussions for today's show, while we had the invitation for live, there was an attempt for a pre-tape discussion as well. I did want to have a live discussion. An offer was made, but timing couldn't work out for a pre-taped interview. And then we did not revisit moving the show because of show plans for my own planning. So just to put that out to be fair. But yes, initially the hope was to have all three of you here for this conversation. And Leila Evans, when you talk about plans made and then fewer flights and then just trying to make an awareness for everyone in the province to understand just what the reality is, what the day-to-day is like for folks trying to get health care in your district, and then you, like you said, you see these flights go down. How do you keep pushing ahead, trying to keep things on track with this? Like, what more traction or what more can be done in order to get folks in order to plug some of these holes and some of these issues that you've identified?
Well, one of the things that keeps me going, because it's really hard on my mental health as well, my mental and emotional health, because the people who are impacted are people that I know, either relatives or friends, or I have some connection to them. So when their health is impacted to the point where their lives they have less quality of life, or they may actually lose their lives to cancer or to cardiac disease, to me, it's really difficult. But what keeps me going is I say I have to make sure the people in the province understand the harm being done to people in my district. They have to understand, because then if they understand, they'll say, this is not right. And that puts pressure on government to try to improve access for our health care. And I'll take an example of where I find that I've been successful. There's been several examples now, but I've been MHA for 5 years, but in Makkovik, which is actually my hometown, For transparency, I'll say it's my hometown. But in actual fact, since I got elected, the doctors are supposed to travel into the communities like every 3 or 4 months to see patients. And then also patients have to travel out. But in Makkovik, since I got elected, which was 5 years ago, I would say the doctor wasn't coming in. I think she came in maybe 3 times in 5 years. And one of those times was because I started asking questions in the House of Assembly. So we had a doctor that wasn't coming to Makkovik. And I started saying, why can't you replace that doctor? Find a doctor that's willing to go into the community, because we had a lot of people. We had several people actually be diagnosed too late to be properly treated for cancer and pass away. And that was since I became MHA. So that was really heartbreaking. We've had some people suffer stroke in actual fact, and then not being medevaced properly in a timely fashion, and have a lot of health impacts. And now we just learned, since I started saying in the House of Assembly this last sitting, why can't you replace this doctor? We are finally getting that doctor replaced, and hopefully the new doctor will be more willing to actually come to our community. And that will actually require less people having to fly in.
Exactly, and that's where I thought you're going with it too, right? Because if you have more visits from a doctor into the community, then you're going to require fewer folks leaving.
Yeah, but it's not enough. We still have, and Postville has a doctor that comes in fairly regularly, and Nain and Hopedale and Napashish and Postville and Riglet. But in actual fact, most of our patients, even with the doctors coming in, we still have most of our patients coming out to Goose Bay, and a lot of them having to go on to St. John's or Corner Brook to access medical care. And we have so many people being bumped off of the flight.
Yeah, you mentioned, right? Which is obviously like if you're thinking about healthcare, if you're trying to get a flight, if it's for medical reasons, and then to get bumped, it doesn't take much to understand or to think about the implications that can have to the individual and to the families.
I just want to show you the consequences now.
Yeah.
I got a call from a mother, and her daughter has heart conditions that's actually complicated. And she called me, and her daughter had a specialist appointment in St. John's the next day. So she and her daughter was supposed to fly from her home community to Goose Bay and catch the evening flight out so she could make the appointment. And she was told around 10 o'clock, oh, no, the hospital flight, there's no seats, it's not coming into Hopedale, so you're not going to be able to get out. So she called me, and she said, Leila, we had to cancel the appointment now, I think it was 5 times. And so she said, her concern was what's happening, because it was almost 2 years, I think, since she's seen the specialist, or it was at least a year where she was supposed to be scheduled in to see the specialist. So she was worried about any complications to cardiac complications. But more importantly was that she had told me that because they had to cancel, they were bumped. This was the 5th time they were being bumped and having to reschedule. And she was afraid because at the doctor's specialist office, the person who's booking appointments told her that if she cancels one more time, they're not going to even reschedule her.
Yeah,
and you can't do that. You can't do that.
Yeah.
Right.
And that's obviously a big issue, right? Because if someone's getting bumped, it's not them canceling appointments. That's them. That's the whole system, right? So yes.
As the MHA, I work with Labrador Grunfa Health, and we actually arrange for a freighter to come into the community to deliver a load of freight, and for them to be able to fly out to Goose Bay so they can make the connection. So that she wouldn't have to go through being rescheduled, and also one of the most important things, I talked to Labrador Grunfa Health and said, you have to talk to this doctor's office, this specialist office, and explain to them. You can't blame a mother for being bumped off of medical flights, and you can't threaten to cancel specialist appointments because of these barriers.
No. All right.
So there's so many layers.
There's a lot going on here. Yeah. Thank you for raising all that, MHA Evans. You're listening to The Signal. I'm Adam Walsh. That was just Torngat Mountain's PC MHA Leila Evans. Also on the line line. We've got Labrador West NDP MHA Jordan Brown. The question we're asking for you folks today, this is the big conversation we're having, is transportation for healthcare. And we're wondering, have you or your family been impacted by transportation for healthcare in this province, right? Driving to and from for appointments, looking for accommodations, food, missing work, all of that. Email us. We would like to hear from you. thesignal@cbc.ca. Text us, 709-327-8206. As we're hearing, so we're hearing from some politicians, right, some MHAs around what's going on in their districts. And I want to take you to the Northern Peninsula for a few moments. Because we're talking about those costs, right, that I just mentioned and how it can all stack up. And on the tip of the Northern Peninsula, there's a population of about 4,000 people. And there's a charity that's trying to help folks. It's called First Step, and it helps folks with those travel costs, right, when it comes to health. So the Signal's Amanda Gear recently spoke with President of the Board of Directors, Mark Wilkoff. We're going to listen to this interview. It's about 8 minutes, and then we'll get back to my guest on the phone, and they'll keep pushing ahead with this show. So here's that tape with Amanda Gear's interview with Mark Wilkoff.
First Step is a charity that we created in 2017 to assist people with their medical travel costs around the province, and even outside the province if they need our assistance. So what we do is we provide help basically in 4 areas. In gasoline for vehicles, we help pay airfare, we help with lodging, and we help with meals. And we've been doing this since 2017, and we've helped well over 600 people and dispersed over $300,000.
What prompted you to start this nonprofit?
Why we started this is my wife and I, in 2015, 2016, began to notice a real need for people who had to travel for medical costs as costs were increasing and the population was aging, and people simply didn't have enough money to go for health care. And as we noted that health care is free, but you got to be able to get there. And so we tried to explore ways to help people. And one of the ways we tried to do was to pay directly to some lodging providers, and they really didn't want to work with us. So what we did is we started our own charity. And one of the reasons we did this is we noticed that there were a lot of fundraisers, individual fundraisers going on around here when somebody had to go for medical care and they had a large family or a large friend base. Those people would have fundraisers for them, 50-50s, draws, any kind of fundraiser they could. And while this was helpful to few, it wasn't helpful to most. And there was a disproportionate number of people who got no help. And so we decided that we were going to step in and do what we could. So we created a charity under Revenue Canada and started to raise money to help. Quite honestly, one of our goals was to reduce the number of private fundraisers because businesses didn't like them. It was unfair. And we used to see, 2 or 3 a month around here. But now we've reduced that number to probably less than 5 a year.
Okay, that's great. And how do you raise money to help other folks out, Mark?
We do it in a number of ways. One, we hold fundraisers ourselves. We do that. We ask for donations. In addition, we have a grant that we get from International Grenville Association. We have a grant from United Way. And we just go out and ask for money. My wife and I have several friends that have contributed both here and from the United States, and we ask for money. I'm not afraid to go into a business and say to them, we have a need, we have a need. Why don't you just give me $1,000 over the next few years?
Yeah.
And I've been pretty successful in doing that. I mean, we have some pretty good-sized donors that believe in what we're doing, and that keeps us going. When we first started out, it took them a while for people to get used to us, but now we're pretty well known, and our numbers seem to be increasing.
And Mark, if people need help for their medical care travel, what can they do and how can they avail of your program, sir?
We have a very strong online presence. So if they want to, they can go online and fill out an application, and that application is sent directly to me, and then the board looks at it. Or they can give us a call. They can call any one of the board members. Those are pretty well known, as well as some people in the community, and call and say, we'd like help. What do we need to do? And for most of our people, they can fill it out online, and that works well. But if they're not computer savvy, or they don't have a computer, or they don't know how to find us, then we're quite happy to call them on the phone and fill it out over the phone with them. But they fill out an application. Once the application is filled out, then I submit it to the rest of the board, and there are 6 of us on the board. We all look at it. We all look at every application, and within a day or so, then we make a determination of how we may be able to help people. Probably, I would guess, 97, 98%. I don't know the exact figure. The number of people that ask for help, we provide them at least some help.
Typically, what are people looking for help with?
Well, they're in need of transportation. So the majority of our people are in need of help with gasoline. And what we do for those people is we provide them with a gasoline card. If they're going to St. John's, for example, we'll give them a $400 gasoline card. And if they're going to Corner Brook, we'll give them a $200 gasoline card. And we keep a lot of data. We've had a lot of data, as you can imagine, with 600 different trips. And so we know what the costs are. So we feel like we can cover those. Sometimes people want to go by airplane. We've cut back a little bit on that because, first of all, we coordinate a lot with Hope Air. I don't know if you're familiar with Hope Air or not.
I am, yeah.
We coordinate with Hope Air. So if someone calls us and or contacts us and wants airfare, we generally will contact Hope Air to see if that's a possibility with them. But airfare is a big deal. It's very expensive in this area, but we do help out with that. So once we get people there, then the next big issue of how we can help them stay somewhere. Mm-hmm. So then we help provide with housing. Payment agreements with several hotels across the province, as well as with the Daffodil Place, with the Ronald McDonald House, with a hostel, so that we can pay them directly. So what this does is we try to reduce the stress that people have with the cost of travel by providing them with enough funds to get by. Because we deal with a lot of people who don't have credit cards. And if they don't get some kind of help, they just don't go. Yeah. They can't. As there's a tremendous push in the province to ship the major health care to either St. John's or to Corner Brook. And as we see that, and as our population is aging, and it's no secret that older people require more medical care generally, and so that is a vicious cycle. And if they can't afford to go, they can't afford to go. So we're here to try to prevent that from happening. Literally have requests from people who not only cannot afford to go, they don't know how to get there, even if they could afford to go, because they don't drive or they don't have a car, mm-hmm. or they don't have someone to go with them. So we try to work around those issues as well. And, we believe in what we're doing. My wife and I always say that, when we were going through our life, there were points in our life where other people helped us, and we're now at a point in our life where we can help others, and it's our turn. Yeah. And that's what we do. We really believe in what we do. We are constantly looking for ways that we can work in partnership with people like Hope Air or with the MTAP folks or whoever are providers of medical travel expenses, because we think that's important. We think our numbers are going to grow, and there are 3 major players out there. We think it's best if we can all work together to solve this problem. It's not only because there are a lot of details when you start asking for help, but some people are simply, they don't know how to ask for help for one reason. If they do, they don't know how to use a computer to access some help. And so we try to step in, and we try not only to coordinate with providers, as I try to coordinate with social workers, both here and in St. John's, to help people as well. Let me just give you a quick example. It's not uncommon for someone here to be medevac to St. John's for medical reasons, and then when they well enough to leave the hospital essentially says to them, okay, you're done. Bye. Good luck finding some way to get home. And so it's not unusual for me to get a call from a social worker or a family member in St. John saying, can you help? And that's, we try to step in.
Mark Wilkoff there, president of First Step Charity, speaking with the Signal's associate producer Amanda Gear. Just look at some stats here from First Step. So they've given out $116,000 so far. You're talking 270 folks traveling by air, 189 private vehicle, 7 by bus. The reasons for these medical trips: surgical, oncology, cardiology, ophthalmology. Right. So it's all there, and also. Mark mentioned Hope Air, right? So that, if in case you didn't know, is a charity committed to providing families from coast to coast in Canada with free flights and accommodations for accessing medical care. You're listening to The Signal. I'm Adam Walsh. We're asking, how has transportation for healthcare impacted you or someone you care about? Email us, thesignal@cbc.ca. Text us, 709-327-8206. We're going to go back to the phone shortly, but I do want to get back briefly to two of my guests on the line. We've got Labrador West NDP MHA Jordan Brown, Torgat Mountains PC MHA Leela Evans. Mr. Brown, anything stand out for you for just what you're hearing there? So you have someone who's working in the community, a couple for some solutions to help folks in and around their area on the tip of the Northern Penn. Anything stand out to you through your lens for Labrador West or just as an MHA?
Well, you look at the community support, like here, the Ministerial Association does a lot of the similar stuff to help people when MTAP fails to be able to help somebody. The Ministerial Association here tends to fill that gap. But, it's just shocking to see how many people have to travel for medical and having to incur that cost personally or through charity. We live in Canada. We're supposed to be have a universal healthcare system where there should be no barriers to access healthcare, but clearly there's a lot of financial barriers still to even access healthcare if you do not live in the metro region. So, this actually kind of flies in the face of the principles of universal healthcare. And it's actually pretty shocking to see how much healthcare actually costs residents of Newfoundland and Labrador, and those who live in rural areas. It seems to be a compounded cost. So, it's almost questionable if this is even allowed under the rules that the Canada Health Act and things like that about healthcare. Is this even allowed, or is this a loophole that seems to have been found where you are incurring a cost to receive healthcare?
How would a government go about plugging those holes for affordability, right? Because when you look at trying to pay for everything, and yes, healthcare being the right that it is in Canada, how does a government go about doing that? Especially when you also look at some, just like sometimes it's federal money, it can be provincial money, depending.
Well, I'll give 3 suggestions to fix some of the things that they could do tomorrow to actually help people in a big way. One is MTAP shouldn't have a copay. If you are asked to go from the healthcare center in Lab West to the health science center in St. John's, you shouldn't have a copay. That should be here you have to go see your cardiologist. Here's your airfare. Here you go. That's the suggestion 1 is make it no user pay, because right now the government pays up to the first $1,000 on their a year for your flight. Right now, a medical flight with return is about $1,400 right now at Lab West. So roughly, the government pays $1,000. A person still has to pay $400 to go out to an appointment. And so my first thing is eliminate that. Here's your ticket. Go to that thing. My second thing is we need more specialists to travel in Newfoundland and Labrador. We need more specialists to come to Goose Bay, to come to Lab West, to go to the Northern Peninsula. Right now, I think we're at the lowest now. Before, when I was growing up here in Lab West, the cardiologists used to come up, and oncologists used to come up, pediatricians used to come in more regularly. Now they barely travel. They make you travel to them. And I think that we have to go back to having more traveling specialty physicians. The third thing is ophthalmology. Right now, I have seen an increase people looking for diabetic eye injections and other ophthalmology appointments. We have no ophthalmology traveling into Labrador right now. If we had an ophthalmologist coming in to do those injections here, I think it would reduce a significant amount of people that have to travel for medical in Labrador West and Happy Valley Goose Bay. So I think those are 3 things they could do tomorrow that would actually have a huge significant impact, and then we can go from there and work on the other things.
I'm going to go back to the phone, so I'll ask Leela Evans, just keep those thoughts that you have right now, and we'll talk about them shortly. But first, I do want to go to Sean McLean, Chief Operations Officer of the Nunatuva Community Council. Mr. McLean, how are you doing?
Good. And yourself, Adam?
Good. Thank you for coming on to the show. And it's a question I've started with both MHAs as well, for the reality for folks in your community when it comes to healthcare and the cost of travel. What is it?
Well, I mean, it's a lot of the realities that both the MHAs on the call are certainly talking about. But before I get into that, MHA Evans raised a very good point about the impacts on her mental health. I appreciate her bringing that forward. So I'd like to take this time just to thank our staff that work in our medical transportation program for all the work that they do. They're hearing folks' stories about their health and their family's health, because in Nunatuva, we're working with, fellow Inuit that are looking to access health programs and health services off on the island or outside of Labrador. And, those impacts are real. So I just want to take time to recognize our staff right off the bat for that.
And it is so true. And we're talking anyone who's listened to stories of folks who are in situations that are challenging and difficult, and you're like that has impacts from the MHAs all the way through the health system and everyone else involved. So I appreciate you bringing that up, Sean.
I guess I could just get in to talk about our Ikalahatagit medical transportation program with Nunatuva Community Council.
Yeah,
it was put in place, and the Inuit word there that you're hearing is helping one another. So our governing council recognized that there was a gap in the provincial health system for Nunatuva Inuit. And the response was to use our own source revenue. And I think that's important to bring it up, because when we talk about the province's responses or the federal government's responses, while we've had great conversations with both levels of government, and they've always opened their door to us, we still haven't gotten over that hump. And NCC, I'll shorten it there, Nunatuva Community Council, is using our own source revenue to help Nunatuva Inuit access medical care in the province. So I think that's important just to bring up that we are funding it ourselves with our own source revenue.
And so what gets covered there, like airfare, private vehicle usage, that kind of stuff?
Yeah, I mean, MHA Evans talked about it, MHA Brown talked about it. What we're seeing is folks, we may not have the same air travel that the North Coast might have, but we do have folks traveling by road to Goose Bay to then take on that air travel. And then we have our community of Black Tickle, which, folks have to get by air from that community to a center and then on to St. John's. So these trips, they're looking like long drives. Just an example, folks in Pinson's Arm, they're traveling by road over 870 kilometers to get to Goose Bay so that they can fly to St. John's for a medical appointment that may be one day. What that looks like for somebody, it's about $3,800, probably around that, a little bit over. When you take Black Tickle into it, where they have to fly out of that community, and MHA Evans talked about it, the experiences of those folks with flights being canceled or being bumped off of flight, and they're missing appointments. And MHA Evans mentioned it. They're missing appointments that they can't reschedule for another few months. But just to talk about that cost for planning purposes, that turns into about a 6-day trip for somebody that has to get a couple flights into St. John's for a medical appointment that, could be one day. That's upwards of $4,000, $5,000 for these sorts of flights. So our medical transportation program assists folks, NCC full members, in accessing those health services. And just as everybody said on the line, these are the most important medical appointments that folks are going to: cardiology, cardiac care, cancer care. And without this travel and without this assistance, folks would get diagnosed too late. We truly believe we're saving lives by providing this program, and we recognize that the province's program also does, do the same. But Nunatuva Inuit are accessing our program more than they would be accessing the provincial medical transportation program. I can say that with some certainty.
Yeah, Sean McLean, you answered my next question, right? I was going to ask, without this, what would the reality be, and what kind of a difference it makes? But you said, right, you feel getting folks to these appointments, to these, getting them having the ability for airfare, private vehicle usage, living expenses, busing, emergency transport, having that funding there, you're saying it's saving lives in your community.
Absolutely, and I thanked our staff at the beginning, but the work that they put into it when MHA Brown mentioned the paperwork-heavy aspect of the provincial medical transportation program. Our medical officers that work, a very small team, work tirelessly to alleviate that burden, because this is a sensitive time. If you're headed out to St. John's for a cardiac care, cardiology appointment, or a cancer care appointment, this is an experience that nobody wants to go through. So our staff do a really great job of walking people through the process, helping assist with travel, booking the hotels and things like that. So we've alleviated that burden at an incredibly difficult time for many.
Is there a learning lesson for the provincial government here, or like for what you're learning, right? With the NCC and with this program, is there anything that other folks can learn from what you're talking about in terms of the success of it?
Absolutely. And, I will say we've had multiple conversations with the Department of Labrador Affairs about their provincial medical transportation assistance program. Mm-hmm. And, we're here to continue those conversations and provide them a little bit of insight as to why our program has been so successful.
What do you think that is? Like, what do you think is making it so successful?
I think we've alleviated some of the paper burden. We know that governments at all levels have specific accountabilities and responsibilities. And, I'm not blaming any of the staff that are in the bureaucracy. I was a bureaucrat for a period of time in my life. I'm kind of a bureaucrat now, I suppose. We've got certain accountability mechanisms, and what that means for the end user or for the patient in these circumstances is they're bound by all that accountability, where NCC, we do request some of those doctor's notes and things like that, some of the paperwork that MHA Brown mentioned earlier, but we really assist with that. And our response from Nunavut Inuit that access our program is that it's easier, it's more personal. And I will say, we're not dealing with an entire province, so I have to include that caveat. We're dealing with, NCC members only. So, we've been able to resource it appropriately. And that's not to say that our staff are not extremely busy with this program, because I know for a fact that they spend every waking minute of their day, working on program or working with patients to make sure that they have access.
Sean McLean, I appreciate your time for the show today. Thank you very much.
No, thank you.
Sean McLean, their Chief Operations Officer at Nunavut Community Council. As we were planning for today's show, we did put in a request with the Health Minister for the Nunavut government, but folks weren't available because we're still in that summer vacation period, so no one was available for today. But here we are with the conversation going back to my guests on the line through this show, and we're asking, how has transportation for healthcare impacted you, someone you care about? Email us, thesignal@cbc.ca. Text us 709-327-8206. As mentioned, Labrador West NDP MHA Jordan Brown has been on the line. So too, Torn Gap Mountains PC MHA Leela Evans. MHA Evans, we'll go back to you. Thank you for waiting through the other call there. Any thoughts from either the first piece of tape we had for the charity, or also for what we were just hearing from the NCC?
Well, just listening to the two callers, the first caller talked about community support and doing fundraisers. That's something I think we see throughout the province. In my district, we have a lot of fundraising, and this is a really good conversation. I'm really glad that you put this together. And what we got to realize is, across the whole province, especially for those who have traveled long distances, there's a lot of people out there who doesn't have any coverage or limited coverage when it comes to health insurance. They may be self-employed, seasonal workers, low income. And for me, that's a huge issue. And that's why, with MTAP, yes, they'll pay upfront the first $1,000, and then they'll compensate up to 75%, for that expenditure. But a lot of people don't have that upfront money. And like for me, I think I was the only MHA in the House of Assembly that was really opposed to all the regional health authorities going under one. We basically put the legislation in for one provincial health authority. And what I said in the House of Assembly, I said, I am very, very critical of Labrador Grenfell Health and how they failed the people of Labrador, especially in my district. But I did not want to get rid of Labrador Grenfell Health as a regional health authority. I wanted to build up Labrador so we would have our own health authority, so we could have like the regional infrastructure for the medical support, along with the doctors and nurses and the specialists in Labrador, so that Labradorians didn't have to travel to St. Anthony or travel to St. John's. That's where the cost really goes up. And your second caller there from Nunatukavut, he was talking about, I think he said like $4,000 or something for travel. But in actual fact, in my district, I was talking to somebody who had no insurance, who didn't have any kind of non-insured health benefits or anything like that, and had an appointment in St. John's, taken her son out to St. John's, and he was supposed to have surgery. They got out to St. John's, talked to the doctor, and the doctor says, no, this is just a pre-consult, just to go through the steps of the surgery and things like that. In actual fact, the doctor said to her, the mother, we could have did this on the phone or virtual. So she had to incur these huge costs. So, there's many layers to the barriers. And then she had to go home, her and her son. She had to take time off from work, and then now to reschedule to go back for the surgery. So there's many layers to it. And also, just talking about, I think it was the member from Nunatukavut was talking about using their own resources. Well, I know during COVID that the Indigenous groups were given monies from the federal government to help cut down on the spread of COVID, manage COVID and the mental health and the physical supports to make sure they be able to control outbreaks. And I will say with the Nunavut government, they're not here on the call right now, but they took their money, a lot of their COVID money, and they bought extra flights, extra seats, so their patients weren't stranded in Goose Bay trying to get home, and that their patients could get out because they had reduced the seating on the planes. And for us to be quite access to healthcare is the biggest barrier we face in my district. We have many generations of colonial policies and government programs that they brought in that really harmed the Indigenous groups in all of Labrador and across the whole province. But it continues in my districts is because we can't actually get to see the doctor or get to have the MRI, get to be able to have a scan, be able to get to actually access chemo appointments, be able to get out for, things related to diabetes. It really is, and it's something that is so. The financial burden is heavy, especially in rural and parts of the province.
And of course, the impacts. I just want to go back to Mr. Brown shortly, Ms. Evans. But and of course, the impacts that you're highlighting there, from health to family to financial, all of it weighs heavy on any family.
So, when you look at what could we do. And recently I've just gone back to the PCs, and I'll quote the leader of the PC party, the official opposition. I'll quote him. He says, "Ensuring that the cost of traveling does not stand in the way of accessing health care by fully covering the cost of travel outside your region for essential care when such service is not available in your region." And that's the difference between life and death for a lot of people, because sometimes the burden of cost basically prevents them from being able to access health care.
Right.
We should not have the cost of travel to access medical care preventing us from accessing care that people in St. John's can access, people in Corner Brook, people in Grand Falls, Windsor can access because they're in the close vicinity of that the doctors.
Yeah, you're talking about a health equalizer there, right? When it comes because of the cost of travel. I want to, Jordan Brown. I want to go back to you for a minute because we only have 5 minutes left to the show. You've got personal experience with the system, and I'm just wondering if you could just for 3 or 4 minutes briefly just talk about what your experience has been like with travel for health yourself, for your family, sir.
Yeah, so I have 2 experiences, and I'll go through them. One, I was a 20-year-old man. My girlfriend at the time, now wife, was pregnant, and I get a call from work saying she was air ambulanced to St. John's because something has happened and we couldn't have the baby in Lab City. So first thing I knew, I had to fly to St. John's to be with her, and we were out there for a few weeks, just waiting on the appointment and waiting to have for her to be induced so we can have the child safely. I was 20 years old. This was before what MTAP is today. It was even more permanent back then. But I didn't have the money. I couldn't afford all this. So, this was a wake-up call for a young individual just being thrown into the healthcare system. 7 years later, my second daughter had a seizure. And same thing again, my wife and my family, we were all thrown up into the air. My wife and my daughter had to go, were airlifted to St. John's again, and they had to stick around in that. And same thing, I wasn't, my wife, had to miss work. I was home with my other daughter. Both times you're just thrown into the air. You don't know what's going to happen. And the last thing you're worrying about is filling out paperwork for MTAP.
Yeah.
That's the last thing you're thinking about. And this is where I find that the system is, egregious in the sense that it requires so much bureaucracy, so much paperwork, so much thing in a very critical time in people's lives. And you're thrown up into the air, and you're asked to get all this paperwork and receipts and stuff like this. It really is, it takes an even more impact on a very stressful situation. And that's why I keep saying, is this fair? Does it actually violate the principles of universal health care when you're at the hospital? Yeah, you're not hauling out your credit card at the hospital, but in order to get to that hospital, you had to haul out your credit card many times.
Yeah. Thank you for that. Ms. Evans, I'll go back to you as we wind down the show here. Any final thoughts for today?
Well, I think people in the province needs to be aware of the barriers, but also the logistics. And, even in Happy Valley Goose Bay that has a large hospital, I'll quote Robert Lake. He's been very public. He's been out there in social media being interviewed, nothing private. He had a newborn, a baby just born, with medical complications, and they wouldn't medevac the infant to St. John. And he texted me. I only saw the text in the morning, and I couldn't believe it because there was a policy in place where they didn't medevac infants after, I think it was 7 p.m. So really, we have to look at reducing all the barriers, the logistical ones as well as the financial. And at the end of the day, what's going to end up happening is if we allow these barriers to stand in place, it's only people with the means, the financial means, the people who are tied to money or has access to money will be able to actually benefit from our healthcare system. And that's not right. That's not fair.
Torngat Mountains, PC, MHA, Leela Evans, Labrador West, NDP, MHA, Jordan Brown. Thank you both for being on the line for this show. It's much appreciated.
Thank you for having me.
All right, folks, that is it for today's show. Thank you so much for listening. As always, if you have thoughts or questions or comments for us, the email, thesignal@cbc.ca. The text line, it's always open, even though the shows share it, 709-327-8206. Or you can call the Signal line and leave a message, 709-576-5260. And like I said at the beginning of the show, there was a scheduling conflict with Minister of Labrador Affairs, Lisa Dempster, who couldn't make the live discussion for today. And we were trying with both sides to get a pre-tape to work. Ended up not happening. We are following up with Minister Dempster's office to see if we can come up with an interview or to plan a future show around some Labrador issues to talk about. Looking ahead to tomorrow, we're going to stay on the healthcare file. Tomorrow, we're going to talk about who's in the professional working side for mental health care. What are the roles? What's the value that they bring? We're going to talk gaps, barriers, what the public understands about roles of folks in the system for mental health care, and what the public might misunderstand about these roles. Plus, we'll throw in a rural-urban divide, right? A real Newfoundland and Labrador show. You're going to hear from some folks who are part of the Association of Allied Health Professionals and the Canadian Mental Health Association, Newfoundland and Labrador. Tomorrow, we're trying to identify and break down the silos in the system. It's going to be a great show. Don't miss it. Until tomorrow, thanks for listening.